Welcome to David Charis Pharmacology. In this video, we're going to be learning about pharmacokinetics, excretion or drug excretion. Now, when we talk about pharmacokinetics, we are looking at ADMA, right? The absorption, distribution, metabolism, and excretion of a drug. Sometimes we take the excretion of the drug as elimination of the drug, but they are not actually the same. When I talk about excretion, I'm talking about excretion by, let's say, the kidney. But I'm talking about elimination. I'm talking about the sum total activity of both the liver and the kidney in removing this drug, removing a particular drug from the bloodstream, converting it into an inactive metabolite or inactive form that can be easily excreted as urine, via the feces, via the lungs, as exhaled air, via sweat. In excretion of a drug, we are looking at the formation of the urine formation, and how this drug process are how these factors that affect drug excretion are coming into play to form urine. So the factors that affect drug excretion are factors that are also involved in the formation of urine. The first one is glomerular. If you remember from your renal physiology, glomerular filtration. Second one is tubular secretion, right? So I'm just going to be looking at these two basically, and probably we're going to be looking at reabsorption. But these two basically are what I will use to explain the factors affecting um, the excretion of the drug, and probably I will add one more. So let's take at the smallest units. I've talked about liver and how the liver undergo first pass effect, metabolizes or some of the drugs, which is actually a process of elimination or a form of excretion, so that this drug can be inactive. And of course, the kidney is the major organ for drug excretion. So now looking at the kidney, basically, I said we're going to be looking at the smallest structure of the kidney. Looking at the kidney, this is the pelvis. Looking at the kidney, yes, I guess I'm drawing this right. This is the outer cortex. This is the inner medulla, and tiny structures in the kidney, which are, you know, they are seen. They are actually called nephron. If you remember from your your renal physiology, they are called nephron or urinary tubules. Urinary tubules. Yes, you can check out lectures on renal physiology to understand this better, but I'm going to make it as simple as possible. Now, this nephron or urinary tubules or kidney tubules, they are important. They are the structural and functional part of the kidney that is important for formation of urine. Now, let me draw a nephron so that you can understand. Just going to draw a simplified diagram. I'm not teaching physiology, I'm taking pharmacology. So a simplified diagram will do. Now I have the um, glomerulus. I have my Bowsman capsule. I have my nephron. I think, let me draw this right. This is actually coiled tube. I have my loop of Elling, coiled tube. Then I have my collecting dots. and the pelvis, which empty into the stuff like that. So yeah, I you can see that I have my blood vessels, which are being coiled up at the site called the glomerulus, and there I have my convoluted tubules, distal and proximal and distal convoluted, convoluted, convoluted tubules. Here I have my loop of Erling or Erling's loop. Let me just write Erling's loop and stuff like that. So in your information, this is of course my renal capillaries, and these capillaries supply the kidney, you know, coil up the nephron and all. So talking about glomerular filtration, now at this particular site of the glomerulus, which is of course a mass of blood capillaries, and in capillaries, fluid exchange occurs, right? Glomerular filtration is the filtration of substance from the blood into the nephron, substance like salts, glucose, uh, some certain drugs. Now, if there is a high glomerular filtration rate, there will be high excretion of the drug, high drug excretion. If there is a low glomerular filtration rate, there is a low drug excretion. Most times there are kidney conditions or kidney disease conditions that can affect the glomerulus, that can cause an inflamed glomerulus. It can cause any kidney issues that can affect the glomerular filtration rate. This can affect the excretion of a drug. That is why when you are giving a medications to an elderly patient, you have to consider the kidney status, the kidney functionality, so as to prevent high toxicity in the blood, high toxicity of drug in the blood. That drug ought to be excreted. So we have glomerular filtration rate. I've explained how this influence excretion. We have tubular secretion. Tubular secretion in the sense that some drugs are secreted into the tubules, into the tube, the hollow tube or the lumen of the nephron or the kidney tubules. Drugs that are, permit me to clean this, please. I hope you get that. I hope you get the structure and the diagram and all. So let's say this is the hollow lumen of the kidney tubules. This is the blood vessel. There are some drugs that are polar. They are polar, right? But they are hydrophobic. They are polar and they are hydrophobic and they are large. This particular drug will diffuse against its concentration gradient into the kidney tubules by a means of carrier proteins that are, that undergo active transport. Remember active transport against the concentration gradients, making use of energy in form of ATP. Also, the same thing with drugs that are non-polar but highly drugs that are polar and hydrophilic, not hydrophobic. Hydrophilic, that is water loving. Drugs that are non-polar and hydrophobic or lipophilic, and they are small. They will also be transported against their concentration gradients by carrier proteins that undergoes active transport and uses energy in form of ATP. These transport molecules are referred to as organic anions and organic cations. So this can also affect the excretion of a drug. Let's talk about one of the most important things in excretion of drug and how we can manipulate or modify the excretion of the drug in terms of overdose. That is the last factor that affect the excretion of a drug. So let's talk about modified excretion or ion trapping. Modified excretion or ion trapping. So let's say I took an overdose of aspirin, which of course, if you can remember from our absorption class, is an acidic drug, a weak acid, and in my blood vessel, I have aspirin overdose. Let's just do it like this. Let's say in my kidney tubules, let's take it the other way. I have aspirin overdose. In order for the aspirin, which is now made inactive, or which is now made polar by CYP450 enzymes in phase 1 and phase 2 biotransformation of drug, and by the kidney, is now trapped or is now in the kidney lumen, the kidney nephron lumen. In order for this aspirin not to cross back to the blood vessel, because this aspirin ought to be excreted, I would have to give something that can trap this polar form of aspirin. That's now what we call ion trapping. Trapping the ion so that it can be easily excreted. Or ion trapping is a way of manipulating or modifying excretion. So remember that aspirin is a weak acid that ionizes to form H plus plus A minus, right? So if I'm to give a substance like ammonium chloride will provide a basic ion, which is A minus, that will trap the H plus form of aspirin, ensuring that it is completely excreted. Let's talk about basic drug like amphetamines. A basic drug like amphetamine will undergo the same thing. Amphetamine, basic drug BH plus, right? B plus H plus. I would need to modify the excretion so that amphetamine will not cross back to the circulation. I don't want it to cross back to the circulation. I will need to trap the polar form of amphetamine, which is now the inactive form, because if it's crossed back, it's going to be an overdose. It's going to provide toxicity issue, and you don't just want that in the bloodstream. So you want it to be easily excreted. You can modify the excretion by giving sodium bicarbonate. Sodium bicarbonate is going to provide an acidic environment that would cause the equilibrium position to shift to produce more of this polar form of amphetamine, not this modified excretion. We have talked about the factors affecting the excretion of the drug, most importantly, modified excretion, aka ion trapping.